Thank you to all of the speakers and to the facilitators. We now have a few minutes for public comment about any particular presentation, any themes, any major issues that were raised across. I think that's appropriate. Yeah, Sam Smith is a great transition.
Yes, thank you for the interview. Actually, this is a question for Ken, or a follow-up. You're talking about the juxtaposition of science and policy and prevention, right? So the question is this: what are funding priorities currently, and the focus in NIH generally on prevention science that is based on psychosocial interventions? Where's the money going, and what does that do? What do these priorities do to projects such as yours in terms of hoping to go to scale at some point?
I'm going to try hard not to get too excited, but I get very emotionally excited about this sort of thing and thinking about policy. In fact, we had a basketball team that won a championship the other night because the 68-year-old coach got really, really excited. Right? So that's what it's about. I think in this country, we still have the belief that grandma knows best, that science is unimportant to raising children, that government cannot help parents raise children, and that government should stay out of the way. We still have that belief. We would not dare build a bridge across the river without having some idea about it being embedded in science. And at least in healthcare, we have some idea about the effectiveness of the surgery that you're about to go into. We don't even think about that in most of our child dollars. That does not even come into play in policymakers' mind, right? They either know it because they know it, or they think it doesn't work because they know it doesn't work, right? But we don't have this technocracy. We don't have this science. So that's what we have to change, right? That's really, I think, an essential framing thing. I think that's an essential point that we've got to make. I'm just blown away by how the science part of the federal government and the service systems to families in our federal government are not even allowed to interact. At least that's what my friends at NIH and over at SAMHSA and ACF tell me, right? ACF and SAMHSA cannot do research by law. They can do evaluation, but they can't do research. And the research system has so few dollars. You know, somebody did an analysis of investments in research in various sectors in our society, right? Whether it's you know, the health industry or transportation or energy or the environment, children, it's like proportionally so little. It's like 2 or 3% of all the dollars spent on children in this country are spent on research. Whereas in even transportation, you know, it's like 15%, right? I mean, it's just, I don't know, don't quote me on the numbers, but it's a huge difference. We just don't think that we even need to invest in research.
For example, I'm talking about priorities specifically for psychosocial preventive intervention.
And that's right. And there's a belief that that's not going to be effective. There's a belief that that does not work. To some extent, it's true that it doesn't work when implemented in the real world. And that's where we have to bridge that gulf, right, and make them be effective. Right? I couldn't tell you, if you take a garden variety parenting intervention delivered in a random city in this country, would I say that it works? I doubt it. Right? Could it work? Yes. We have the knowledge. Right? But does it work? I don't think so.
Okay. Thank you. So I'm going to suggest that you stay at the mic until the question is answered. I actually moved away from the mic when I asked mine and then wanted to come back so that if there's a follow-up question, it's on the record.
I don't have a question, I have a comment. My name is Alan Shevlin, and I run an organization called Real Fathers, spelled R-E-E-L, as in a movie reel. And I just want to share a word with you and an observation. The word I want to share with you is dadvocacy. And the observation is I'm used to going to meetings for the last 20 years and doing qualitative research on involving fathers. And it's really unusual for me not to be the only guy in the room. So I'm really delighted to see so many dads, granddads, fathers, and so many people talking about the importance of engaging fathers. We're doing a presentation at the World Early Childhood Organization in DC in July, and the title of it is Doubling the Odds for Early Childhood Success, engaging dads. Thank you.
Thank you.
Oh, do you want to? Hi, I'm Emily Dropgun. I'm here with the National Head Start Association, and wanted to thank those of you who spoke today about some of your own work with Head Start and the role that it's played. Just last week, we celebrated the 50th anniversary of Head Start here in DC. We had Dr. Ed Ziegler with us and Dr. Edmund Gordon, and really a chance to look back at some of that history and how invested Head Start has been in research for 50 years.
We're going to celebrate it all year.
Absolutely. And so as we're preparing now in the Head Start community for a reauthorization in the next few years and this opportunity to reflect and to think about innovation and reinvention, we've seen some great research come out in the last few years about Head Start's effect on fatherhood involvement, on parental education, on a range of other things. And just wanted to ask that question, sort of how does that relate to a lot of the work that this committee will be doing, and how do you see the role of Head Start and other early childhood as a platform for some of these parenting and other interventions that stabilize families?
Okay, Aurora and Michael, do you have comments?
It's interesting that you made that point, because in terms of mothers who are at risk for depression are less able to parent their children in ways that are emotionally and cognitively stimulating for the children. And they don't trust people and go for help. They don't even always know when they are depressed. And one example is that when they bring their children to a place they trust, like Head Start, there can be a way for them to be evaluated and to be monitored. And then they can be told that if you get help for this, this will help your child. And they might go for help if it will help their child and not just be of help to them. But Head Start is one of those places. The school system is one of those places because the evidence is that people who are psychologically better off are able to better parent their children, as we have all said today. And I disagree with one thing that Professor Dodge said. Animals do need mothers. The research shows they don't need them over the same period of time that we do, but they do need mothers in order to develop well. So I think the research will show that.
Michael?
So I actually have a question for the person from Head Start.
Michael, can you get the microphone?
Two aspects in terms of...
You have to use the mic.
It looked good, though.
You turned down the intervention.
One is what you all see as the implications of the move toward universal pre-K for the place of Head Start in the early childhood field. And tied to that, we talk a lot about Head Start, but early Head Start for many of the children that we're talking about is really a critical element and serves a much smaller percentage. And how you see the role as the Head Start Association of early Head Start fitting in all of this.
Sure. So we've been having a series of conversations, individual calls with Head Start programs in every single state over the last several months, planning for reauthorization and thinking about these issues as a field. And we don't have final documents out of that process yet, but the themes that have come out is that for a certain subset of families who need that level of case management and need all of the other social services and mental health services and other resources that Head Start can provide, there will probably always be a subset of 4-year-olds who need that level of service who may not be best served by a pre-K system. That said, the Office of Head Start in the last few years has moved towards this birth to 5 model, which allows programs more flexibility to decide in their community, given their community needs assessment, how does it make sense to allocate slots and funding across the birth to 5 continuum? Does it make sense to have more early Head Start, 0 to 3, because you've got a strong pre-K system in your community? Are you in a state that doesn't have any pre-K or doesn't have a strong pre-K system and you still really need those preschool services? So at this point, we're really focused on that need for local design and local determination about what their communities need, but certainly the ongoing flexibility to serve children up to their 5th birthday.
Thank you.
Do we have time?
Yes, we do. Selja?
Well, then I have a bonus question for Dr. Dodge. The work that you describe in Durham Connects, right, is built on a lot of research that we have in this country. And unfortunately, like you said, it's very difficult to design a new system, right? The whole city or neighborhood or state. But there are many new nations that are being built in the Balkans, in northern Iraq, Afghanistan. You know, there's a lot of rebuilding process. There are some nations building new systems in Africa. You mentioned Larry Aber earlier. He's involved in some of those. So I wonder if you are aware of any new systems that are built on some of the work that you built your system, because some of these are universal. And the systems that I'm aware of, I was in northern Iraq a few weeks ago, actually. It is not really linked to any of the research that we are familiar with. So I was wondering if you have any information, any connection, whether you are involved in any of this work, because I think other children in other parts of the world would really benefit from the work you have.
It's a terrific question, terrifically important question. I'm afraid I don't have a good answer. Thought about it, and embedded in a context where I've got a lot of colleagues who are thinking in terms of global health and international work. I am sure it'll be different. You have to start and understand the community. I think about a former undergraduate student of mine, Carmel Wong, who spent a year in rural India delivering parent intervention to a mother. It took her 6 hours to travel to her home, and then 6 hours to return. So just to think about delivering some kind of intervention in that context, we're going to have to think in a different way. I don't know the answer. I have to think that technology is going to be the answer. Telephones and smart technology is going to connect us from rural areas and in areas where there may not be an infrastructure. I have a feeling that the electronic infrastructure is going to grow more quickly than the social service infrastructure.
Can I just follow up, because I think my question wasn't clear enough, and we have time, right? Like in northern Iraq, there's no issue of money. There are tons of money there. And people who are building the NIF system for health and education, like if we start from scratch, I think we would build something quite different from what we have right now here, like you said. So they are doing that. It's almost like an experiment. And they are getting a lot of consulting from the United States. You know, a lot of big companies are involved because of the dollars. And I don't see scientists or child developmentalists or anybody who are in this room and the knowledge in this room being part of that conversation. Well, so I'm not talking about, say again?
First thing I'd say is whatever we're doing.
Let's go together. I have an invitation for you. Yeah, we could do this. I mean, there are some, there is demand on the ground, but we will follow this up.
There is potential for thinking about that, though, in the U.S. context, where people are living in rural areas that are very much isolated. So it's not just limited to going outward to international sites. Oh, okay, thank you.
I'm Yoli Flores with the Campaign for Grade Level Reading, and I wanted to share just a couple of reflections from actually a number of the panels today. The first one was Dr. Eden's conversation with us and her story about fathers really wanting eagerly to learn and to really have the tools and the resources to be very engaged fathers. And it reminded me when I started my career at a very unlikely place for a social worker at the LA Department of Water and Power. And we created a workplace program for working families. It was called DWP Family Care. And of course, at a very large municipal utility company, it's mostly men. And so we made a great effort to reach fathers and had all sorts of supports and activities. They were most interested in the breastfeeding program that we had for the women, because they wanted to also use the tools and resources and the traveling breast pump for their partners, because in their employment and their employers or their workplace, they didn't have a program like this. So all of that brought to mind just that the importance of the workplace and how during the 90s there was so much more activity around employer-supported childcare and supporting parents in the workplace. And really wanted to encourage the committee to think about that as a system where we can reach and support parents. The other thing that called to mind was the recent New York Times Starbucks story that many of you will recall, where the changing schedules for parents created chaos in their family life. So how do we raise the consciousness of employers to attend to the working family and the supports that families need, not only for the time that they need, like the affluent mothers and the physicians, to come together and to have support, but also for the kind of workplace policies in general that impact families. The other very quick reflection was Dr. Luther's work around affluent families and the physicians. And what struck me was how she underscored the importance of a mother's well-being and the time and the care and the self-love and care that mothers and fathers need. And I wanted to remind the committee and all of us that it's not just affluent mothers that need that. Because oftentimes when we think about low-income parents, we think about what they need in a much more judgmental way, about their behaviors, the information that they don't need, the knowledge that they don't have, and all of that may be true, but they too need that well-being.
Thank you. That was terrific. So we're going to bring this to a close now. I want to thank the speakers who were terrific, informative, insightful, and useful. You offered data and critique of data. You provided perspectives on what's needed and the barriers to change. And you shared perspectives on the possibilities for supporting parents and the context in which they care for and support their children and families. I want to thank those who asked questions, thank those who attended and listened and didn't ask questions. And then lastly, I want to thank the committee members for your continued work and invite you to go back to our room and work just a little bit more. Thank you so much. Have a great day.